Our patients and our colleagues are why we fight. And why we will continue to fight until our healthcare system truly reflects the values of our profession: compassion, access, a respect for human dignity and rights. We have a long way to go, but I'm committed to this work, and I am ready for this fight.
That's Flint physician Dr. Bobby Mukkamala. He's the 180th president of the American Medical Association. His presidency is historic. He is the first doctor of Indian origin to lead the organization. And during his inaugural address in Chicago Tuesday in front of lots of people from Michigan and friends and family, Dr. Mukkamala laid out his vision of progress, inclusion, and ensuring quality health care for all people. A tough charge that Dr. Mukkamala says he is ready to lead. And the newly installed president of the American Medical Association, Dr. Bobby, as we affectionately call him here, is our guest today here on First at 4 Focus. And Dr. Bobby, thanks so much for joining us today, and congratulations to you.
No, thank you so much. It's wonderful to be at home. It was amazing several days in Chicago with a couple thousand people there, but it's good to be at home.
Yeah. Were you surprised at the number of people from Flint and from the state of Michigan who showed up to be a part of that moment and celebrate you?
Yeah, it was fantastic because, you know, I kind of said to my physician friends that they should be members of the AMA if they want to come celebrate this with me, totally expecting it to be less than the average number of people. It's never sold out before. It was totally filled, and we had to find another 100 places for people to sit. We got to 1,150 people.
That kind of speaks to the impact you're going to have on that organization.
Well, I think that, and also the first Indian. I mean, there are multiple reasons, a lot of Flint, Michigan folks too, but thank you.
I know it's only been a couple of days, Tuesday, and you've had to hit the ground running, but what's been your first order of business as president of the AMA?
Yeah, I think that, you know, we have our priorities, like, you know, decreasing problems like prior authorization and physician burnout. But for me in particular, the last 6 months, I'm dealing with my brain cancer issue has just made me so interested in closing the gap in access to care that we have in this country. You know, my access was phenomenal, right? Went to one of the best places within a few weeks, got my surgery done, and it's been amazing since then. But I can tell you that none of my neighbors, none of the community that's watching us now would have that kind of access. And that gap won't close completely because I'm a doctor and I happen to know people. But just to be able to close that gap even a little bit in this, you know, one round I have as president, which will be over in 363 days now, just to start the momentum to close that gap is going to be wonderful.
Yeah, and it can make a lot of difference. A little bit can make a lot of difference.
Absolutely.
Some of this you laid out in your inaugural address. You know, you talked about the disparities. And what would you say the state of healthcare in America is right now?
Yeah, I would say that we spend more than anybody on the planet. Right. I mean, twice as much as the next person, the next country on the list. And yet we are below average in pretty much everything. Right. And, you know, the other thing I notice is when we go down I-75, you see billboards and every hospital is advertising about hernias and hips and knees and procedures. Right. When the disease gets bad enough to cause a problem, that's where all the advertisement happens. I would love to see us prevent disease, right? Taking something like pre-diabetes and not having that ever turn into diabetes because we're on it.
Because you attack it at the onset.
Exactly. That's how it should be. And I think that as a country, we don't invest where we need to invest. And it's, yes, I understand when people have a problem, we should take care of it. But the more we also invest in prevention of those problems, over time, that's a wonderful investment. People are happier, people are healthier, and we don't spend any more, but we're a healthier country. And that's what I want to see happen.
So your presidency is 1 year, you know, 180th president, and it's a year-long presidency. So Dr. Mukkamala, these are some big charges. How do you begin to lay the groundwork, your presidency began to lay the groundwork for some of this transformative change that you've talked about here?
Yeah, I think that happens with conversation. You know, I noticed just in the past 48 hours, there's these Facebook posts. The AMA put one out about congratulations to Dr. Mukkamala for being the 180th president, maybe the 7th one from Michigan since the 1800s, which is all amazing. And most people are complimentary, they're like, congratulations. But I've seen a few posts about there's so much wrong with healthcare and what can he do and things like that. And I think it's communication with people like that that helps us move that down the road.
We're talking to Dr. Bobby Mukkamala, and we're going to continue our conversation with Dr. Bobby. And when we come back, he'll talk about the very serious health challenge that he faced last year.